together we are one.
Bringing the future now. A documentary of women in water and natural resource conservation program, Kakamega, Kenya. 50 years since independence, women in Kenya are yet to get the load off their backs.
Women in Water and Natural Resource Conservation is a non-governmental organization that was started in the year 2009 and was officially registered in the government of Kenya by the NGO board in the year 2012. Since inception, WECAN has been on the ground, and so far we've been able to work with 10 women groups in different parts of Kenya. And one of the projects that we've done is that we've been able to train women on water, sanitation, and hygiene. The reason why we started this project is because having been born and brought up in a rural setup, I saw the challenges that women were going through, walking for long distances, fetching water and carrying water on their heads for like a kilometer. And so that is why we came up with that project. And so far we've trained about 3,000 women on water, sanitation, and hygiene. And we've also constructed about 10 rainwater harvesting tanks. And we've been doing that with the help of the women that we've trained them as masons. And that is an aspect that has captured the issue of sustainability.
Today, more than before, challenges that women, the young, the elderly, and the old are going through are more painful and enslaving.
Yeah, so we've also trained women on issues of entrepreneurship, where we've partnered with the county government and the Ministry of Trade, and we've been able to train about 100 or so women who can now access local loans, and that is an achievement to us.
There are many problems today that are affecting the developing countries. And Kenya being one of the developing countries, especially in Africa and the sub-Saharan Africa, to be specific, is facing so many problems. The problems ranges from political, economic, and even social. And one thing that I've realized is that women, especially those who are in the rural setup, they are so much affected and they have no voice to be able to defend them or to be able to make it known what they're going through.
These challenges include women struggling with health, being the worst hit by HIV, stroke AIDS, and other terminal diseases. Women spending the last coin due to poor sanitation and lack of fuel.
The vision of this organization was mainly based on the fact that we interacted with the women on the grassroots in the villages and communities where we come from, and we noticed that they were going through a lot of hardships because of issues that pertain mainly to women. One, they had issues with water supply, where women were going very far away to look for water. Girl children were also missing school because of going out to look for water. And all this amounted to our decision to try and come up with an organization that would really help women even to go over the problems that were going and improve the education of the girl child within our community.
Kakamega, like many parts of the country, is facing scarcity of clean water and proper sanitation, substandard housing, disease vectors, and indoor air pollution.
On the issue of water, sanitation, and hygiene, we've also been able to start a project of construction of VIP ventilated pit latrines to primary schools, where one of our projects we were able to rescue a primary school that was about to be closed down because they didn't have, the girls didn't have the proper VIP latrines. So we are able to construct 4 ventilated pit latrines, and as we are talking now, they are in school, and that is an achievement that we count on as an organization.
Before bringing the toilets you put up for us, we had no any other place or places for my children to assist themselves. But now to your construction of 4 toilets, and I run a bit, and a place for the female children to assist themselves during their periods, we are now comfortable. When before providing us with the toilets, our mean score, according to academic wise, it was 228. But up to date, the recent examination that we did, the district, Navajo district, we have a mean score of 263, which means that the toilets are greatly affected my school, and it is now performing well.
And on the same project, we are also constructing, we've trained women on how to construct bowls and filters, because remember we are looking at water quality, we are looking at sanitation services, and we are also looking at hygiene. So on the issue, on the aspect of water quality, we are also training women on construction of bowls and filters, so that the water that they are harvesting, the rainwater they are harvesting, to make sure that it is clean and it is safe for use, we encourage them to use bowls and filters. And the better part of it is that these women are the masters. So that means even after we are done with the project, they're able to take up, be able to manage the projects. They are able to renovate in case there are any leakages, and that is an achievement that we as an organization can look at and say that we made a step in our community.
Before we had water, we really had a lot of problems because we are supposed to go to the springs, and then we were getting water when we were paying those people who are bringing for us water, and it wasn't enough to cover for facility cleaning. But after the implementation of the first tank, it really had a lot of impact because we were able to conduct a lot of delivery. We were at 0 delivery, then we moved to 5. Later on, when it rained, we actually moved to a delivery of 10, 20, until now we are conducting around 36 delivery. This has made the facility to be recognized, changed from a dispensary to a health center. And then after that, we have been recognized from national level, county level, whereby we have paid a lot of money from deliveries we had conducted. We are able to improve the features of the facility, starting from the gate. We have been able to construct the watchman house. We have equipped a maternity unit, of which right now is of a level of even county level or even a professional referral level. We are proud of that.
Different environmental problems affect the rich and the poor in different ways. Water-related diseases tend to affect the poor more severely. They are the hardest hit by environmental pollution because they live in areas where environmental protection is frequently the weakest. Such sites are often the only place where low-income groups can build or rent houses without fear of eviction. Inadequate diets worsen the environmental health risks of the poor by lowering the resistance to many diseases.
One thing that I've realized when working with WECAN is that I have received an insight on what really women go through. By interacting with the grassroots women, the girls, the young and the not so young, through WECAN, I've been able to understand their stories, the anguish, the pains, the desperate, the many questions they have, yet no one wants to volunteer answers. And this has really challenged me, together with other people outside there, to look at women from a different perspective.
Okay, the challenges that women face, especially in developing world, first we have the issue of school dropouts, especially the young girls who are in school, and this is because of lack of sanitary pads.
Sometimes you can miss the sanitary towels, so it's a must to use some rags. Women had arranged that they shall be giving out the sanitary towels in the school, but we did not find them. So we need them.
Another challenge is access to water quality and quantity, and women have been having issues on accessing quality water.
I'm a water champion. I've grown all my life carrying this. I bet you can see it on my head and you can guess how much it weighs. This could weigh about 45 pounds. This is a 20-liter jerry can. I used to miss school, not going to school at all. I know many girls out there are suffering like me. Many women are suffering.
There's also a challenge of sanitation where we do not have quality sanitation services at grassroots level.
WECAN is involved in supporting, facilitating, and coordinating the following: water harvesting, ecological water sanitation, water analysis, and water infrastructure.
Another problem is the issue of jiggers. It has been a problem in our community. So many women, young people, and even children have had this problem, and it has hindered their development in the community. The children cannot go to school, the women cannot, go out and work in their fields. So that is also a big problem that we are facing in the community.
Support for orphans, vulnerable children, and persons living with HIV/AIDS. Health-related support programs like anti-jigger campaign, menstrual hygiene, HIV, and AIDS. Environments and natural resources conservation and food security. Education, training, and capacity building.
I am appealing to men outside there. I'm appealing to organizations outside there to turn and give an ear, lend an ear to WECAN, because what it is doing here in Kakamega, Kenya, and at the East African region is something that is noble, something that we need all of us to embrace and support. They are out there to help so many women to find their footing, to regain hope, aspiration, and also to have dignity. And this is something that every other person should help. For example, when you look at the proposed WASH Training Center, this is a unique venture, this is a unique program that will be out there to equip women, to help them with skills on how they can be able to solve their own problems, social, economic, and even political problems. And also when you look at the women and the young girls that are being supported to pursue courses in community-based, community development courses on community health and HIV, these are a strategy on sustainability. When these young girls are being trained through WECAN, they'll be able to go back there into the villages and support the many women that have been left there, those who are at the verge of dying because of desperate or because of untreated diseases. When also you look at the Future Now event, the annual event organized by WECAN, this is also a very unique event that always jog our memory to be able to understand the importance of water, environment, resource, and natural resources, also including hygiene and sanitation. When we meet every year under the auspices of Future Now, organized and sponsored by WECAN as an organization. It helps us all as participants to be able to exchange ideas on the best way possible that we can be able to assist women.
WECAN pursues an integrated socio-economic and cultural development approach in the fight against poverty and social exclusion of the communities and families.
The NGO has a physical office in Kakamega town. This is a town in the western part of Kenya, and the office is run by a number of staff that are basically there, and I would like to say that mainly the source of staff that we run with are volunteers. We have volunteers that go out in the field to work with the women groups and the CBOs, and we also have volunteers that work within the office and in the day-to-day running of the organization, and they have helped the office to keep open and to keep running even together with the administrative.
Okay, the reason why I undertook this course is because I had the vocation, the calling to help people in the society. So I found it necessary to go and get the necessary training so that I can be in a position to practice in a professional way. So the other reason why I undertake social work is because there are so many social problems in society, and we lack the necessary solutions to solve those social problems. The other reason why I undertook social work is that there are inadequate human resource who have been trained in social work and community development. So I had to fill the gap.
The reason why I decided to take this course is because I come from a polygamy family, whereby I have lived enough to see many challenges that I've really faced us as young ones, as we grew up. Being born in a polygamy family, there is many challenges that we face.